Well, hello, everybody, and welcome to our webinar on healthcare's climate footprint, presented by Healthcare Without Harm and its Global Green and Healthy Hospitals program. My name is Nick Thorpe, and I am the Network Director of Global Green and Healthy Hospitals, and we're really excited to see such a great attendance today. We have attendees coming in from countries on 4 continents, from the Americas to Europe and Africa, so good morning, good afternoon, and good evening, depending on where you're based. We have a really great webinar ready for you today on a very important topic that I know is on top of everybody's mind and that we're beginning to experience more and more around the world, which is climate change. Healthcare Without Harm in September of this year released a report that it did with ARIP to examine what the global climate footprint of the healthcare sector is, again, at the global level and also broken down by countries. What the sources of those emissions and footprint is, and also what the opportunities are to act on that, to mitigate our impact and to set forth a trajectory towards climate-smart healthcare and healthcare that has net zero emissions. We have a great group of presenters here today with you that I'd like to introduce. So really great mixture of presentations, one at a kind of higher level of the findings of the report and another on how the actions are being taken on the ground to address it. Throughout the webinar, we are recording it, and afterwards the presentations and the recording of the webinar will be available to members of the Global Green and Healthy Hospitals Network. And if you're not already a member, I'll share some information at the end of the webinar on how you can join. And throughout the webinar, we are taking questions, and we'll have both presentations take place and then have some time at the end for questions and answers. And so at the bottom of your screen, you should see a question and answer block, and you're welcome to input your questions in there, and we'll take them and present them to our presenters at the end of the webinar. And so with that, I'd like to pass the ball to Josh to begin his presentation.
Thank you, Nick, and good morning to everybody from San Francisco. Good afternoon and good evening to all of you joining from different parts of the world. It's so great to see so many people joining us today. So as Nick mentioned, I want to talk to you about Healthcare Without Harm's latest report, Healthcare's Climate Footprint. But first, just a little bit of context. We all know that the climate crisis is accelerating. Indeed, it is impacting us far more deeply and far more quickly than scientists had anticipated over the last many years, since the late 1980s, when the world's governments first made the agreement that created the United Nations Framework Convention on Climate Change. We are living it. We're living it in every different part of the world. The poor are the most impacted. Those most vulnerable are the most impacted, those least able to respond to the crisis. And at the same time, everybody's impacted. And it's, as we know, climate change is impacting our health, whether that is from the migration of different vector-borne diseases to increasing severity of storms, floods, droughts, heat waves, forest fires, the exacerbation of air pollution, and just the increase of air pollution, which is driven by the same drivers as climate change, the combustion of fossil fuels. Indeed, we are living increasingly in a global climate emergency. Many governments have declared now a global climate emergency, and increasingly a number of health systems are saying this is an emergency. And it's also impacting our mental health and the mental health of our children. I just had a conversation last night with my 20-year-old daughter, who told me about a dream she had where the Golden Gate Bridge here was collapsing, and it was a climate anxiety dream that she'd had. And then she commented, you know, she wasn't sure whether she wanted to bring children into this world, given what is happening. So the point is, it's urgent. It's urgent that we take action. And as we know from the Intergovernmental Panel on Climate Change report last year, if we have about 11 years left now to actually reverse the trajectory of civilization, if we're not to we are to avoid the most significant impacts of climate change. Our health systems, as we also know, are woefully unprepared to respond to this issue. Healthcare, both the health professionals, emergency responders, doctors and nurses, as well as our hospitals and their infrastructure are on the front lines of climate change. And we know from our experience in many countries when extreme weather events hit, our health systems are some of the hardest hit, and yet they need to be the last building standing. They need to remain operational, and we need to be able to provide the response to the climate crisis in order to treat the damage the human damage that is created by climate change. And so we've been quite aware of this for many years, and the health impacts of climate change have been studied and documented, and health sectors increasingly active and engaged on addressing the issue. But what we don't really know or haven't known is what the contribution of healthcare is to the climate crisis. And you know, there have been some studies. So the National Health Service in England has done an amazing job in documenting its own climate footprint. There have been studies in the U.S. That found that, for instance, the U.S. is about 9% of total emissions from the United States. There have been studies in Canada and Australia, but there's never been a global understanding of healthcare's climate footprint. And in order for us to do our part as the healthcare sector, we need to address this footprint. And in order for us to address this footprint, we need to understand what it is, where it comes from, where it's the biggest, and more. And so that was the goal of our report, was to set out to basically establish this baseline understanding globally in order to figure out how to begin to align the healthcare sector with the ambition of the Paris Agreement to move toward zero emissions by 2050, while also meeting the global health goals. So we need to figure out how to meet global climate goals while we're meeting global health goals. And in order to do that, we need to understand what the contribution of the sector is to the crisis and then how to address it. So here's the big headline finding out of the report, is that healthcare's climate footprint is equivalent to 4.4% of global net emissions. Well, what does that mean? To put it in a little bit of context, that's the equivalent of the emissions every year from 514 coal-fired power plants. Or to put it another way, if healthcare were a country, it would be the 5th largest emitter in the world. So that is a significant impact. And before I get into sort of how to break that down, I guess my slides were in a bit of reverse order. This one should have come first. But here's what this paper does. First, it establishes this first ever global estimate of healthcare's climate footprint, as I said. It is based on full global coverage of spending data. That means we've looked at global spending databases, and then we've been able to get detailed information from 43 countries. It identifies key sources of healthcare emissions while allowing for comparison between different countries and among different regions of the world, and it makes a set of recommendations. So as I said, the finding is 4.4%, and then here's how we actually came up with the approach to this. We took a global input-output database that is called WEOD that captures all global trade relationships. And so that's the full global spending that I mentioned. And then there are a set of environmental extensions to that database that look at emissions data. And out of that, we were able to calculate total greenhouse gas emissions, not just CO2, but other emissions as well, for all categories in this global database. And then we mapped that to the WHO, OECD healthcare expenditure data. And so we were able to basically identify all healthcare categories of spending and then map that to these emissions based on global spending. And that's what gave us our results of global and then the national healthcare climate footprints for 43 countries. And so you can see these are the different, some of the different categories of healthcare that we mapped it to. And then we also mapped this to what is called the greenhouse gas protocol, which many of you are familiar with, of scope 1, which is on-site emissions, scope 2, which is purchased energy, and scope 3, which is everything else, which is primarily the supply chain. And so we also, in addition to coming up with the overall estimate, we're able to begin to break it down into these different scopes, which are what is the standard for understanding climate footprint in institutions and governments. There were a few limitations to the study. So there's significant limitations. So while we had global data and are able to come up with a global estimate, there was not sufficient data in the databases that are available to be able to make any significant estimate for Africa or the Middle East as a region or for any countries in those regions. There was also limited data on many low-income and middle-income countries in Asia and Latin America. And so while we have regional estimates for those parts of the world, we're not able to come up with a lot of country estimates, except for countries like Brazil, Mexico, Indonesia, India, China, a couple of others. There's also some challenges in terms of getting more granular data when we align that big global database with the greenhouse gas protocol scopes. And there were also areas that we were not able to document globally because we don't have global information, such as anesthetic gases, which we know are significant contributors in many countries to hospitals' emissions, metered dose inhalers, similarly, and patient transport. And so, for instance, you know, we came up, you'll see with a figure for the United States that the U.S. emissions are 7.6% of the country's emissions, whereas a more granular national study came up with a higher figure of 9.8%. But nevertheless, despite these limitations, this gives us a big worldwide picture and allows us to see what countries are doing in comparison to each other and understand the big picture dynamics. But these are some of the limitations that we're going to need to get over as we move forward with the research that we're doing, which we will continue as we continue on our work to move the sector toward addressing its impact. So here are the findings broken down. There's 6 different areas. First of all, the first finding, which I gave you the big headline of before, which is healthcare's climate footprint is equivalent to 4.4% of global net emissions. And you can see from the chart on the right, which is probably pretty small on the screen that you're watching, that some countries are over that 4.4% average for their country. So that, again, the U.S. we found, you know, as 7.6 in this study. Japan, Korea, Canada, Switzerland, Belgium, all these countries are above. Some are less, like India, much less than less than that 4.4% of its net global emissions. So it really depends on the country, and we'll get into why that is in a minute. So this wheel is the WEOD database that I mentioned that breaks it down by different economic activities. And the big finding here, which should come as no surprise to anybody, is that more than half of healthcare's climate footprint comes from energy use. So you see that big 40%, that's the generation and distribution of electricity, gas, or heat and cooling. At the same time, there's operational emissions, most of which are energy, which is 13%. There's another big chunk for transport. And then a lot of the other activities are obviously using energy to generate their products. And so it's the lion's share really of the footprint is energy, although there are other sources like, for instance, anesthetic gases or methane from waste, that kind of thing. So that's the second big finding. The third one is that healthcare's climate footprint generally reflects overall national emissions patterns. So if you look at the wheel on the right, there's a bit of a flip there in that as everybody probably knows that right now, China is the greatest emitter in the world of greenhouse gases. Yet, when you look at the healthcare sector, the United States far surpasses China, and China's number 2. So the United States is responsible, the United States healthcare sector, for almost a third of all the sector's greenhouse gas emissions. China comes in at 17%, and then the European Union and all the countries of the EU come in at another 12%. Together, that's half of the world's greenhouse gas emissions, just those. And then if you include Australia, Canada, South Korea, India, Brazil, Russia, and Japan, those 10 altogether make up 75% of greenhouse gas emissions from the healthcare sector. So a very few countries are responsible for the vast majority of greenhouse gas emissions, and that's really no different than our understanding of worldwide emissions overall. There's a little bit of difference in the ordering, but there are a few countries in the world that are driving this crisis, and yet there are also emissions from that other 25% from all other nations. So that was the third finding. The fourth finding is that decarbonizing healthcare supply chain is actually critical if we're going to, again, align the sector with the ambition of the Paris Agreement and get 45% reduction by 2030 and net zero emissions by 2050. So you see in the chart on the left, 71% of healthcare emissions are from scope 3. Again, most of that's from the supply chain. 17% are on-site emissions, 12% are scope 2 or purchased energy. And then on the chart on the left, you can see how that generally breaks down. One of the things that we need to do for further research is understand that breakdown of scope 3 and the supply chain much better. So for instance, you can see agriculture is 9%. In agriculture, that's not just food services and food production and transportation, but that is also the, for instance, the growing of cotton for surgical gowns that are cotton gowns and more. So, and you can see pharmaceuticals is very small there, but it doesn't include all of the energy used to generate, to produce those pharmaceuticals. So one of the next steps is to really figure out the supply chain in much more depth so we can then come up with ways to address decarbonizing the global supply chain. And you can see these breakdowns in a little bit more detail here with a few selected countries and regions. In the report, in the appendix, you can find snapshots for all 43 countries for which we have detailed data. This finding, which kind of goes with the energy finding, is that fossil fuel combustion is at the heart of healthcare's climate footprint. So if you look at all of that energy generation, most of it is coming from fossil fuel combustion, the combustion of coal, oil, and gas. And so in the end, whether it's in the supply chain or whether it's the on-site emissions or the purchased energy, the vast majority comes from healthcare's dependence on fossil fuels. Again, no different than the rest of civilization, the rest of society, and it means that we need to help as a sector figure out how to move away from that dependency on fossil fuels, not only in our facilities, but in the overall grid in which our facilities and our systems are dependent on. And we'll get to that in the recommendations in a minute here. So the sixth finding is that healthcare spending and the sector's growth is an important factor in emissions. So this chart, again, I'm sorry that these charts look so small on your screen, looks at healthcare's footprint per capita and looking at then the percentage of gross domestic product spent on healthcare on the left. And so it's ranked by that. So the United States is top with, again, this is a World Bank figure, 16.5% of the U.S. economy is spent on healthcare. And this is a very uneven chart, but you can see it sort of descends in order in general. And so as you go down that chart in terms of percentage of GDP spent on healthcare, there's less emissions per capita. There are other factors involved, as you can see. You know, France is number 2 in spending on healthcare, but it's not so big in terms of its emissions. that has to do with the energy mix of the country and the carbon intensity of the electrical grid in different. But there is a correlation as well. And this is important because as some countries grow in their healthcare investment, it may mean that their climate footprint goes up unless they can decouple their spending from their emissions. Similarly, it also points to perhaps the need to reform healthcare systems like those in the United States, which spend way more than other developed countries with less good health results coming out of that spending. Okay, so moving into the recommendations and the conclusion here. As I said at the outset, health, as with every sector of society, has the responsibility to align its actions and its development trajectory with the Paris Agreement in order to stave off the worst impacts of climate change. And so that means, you know, even countries that have a low footprint right now, if they are investing in healthcare development and growth, we need to figure out how to support countries to align with Paris rather than to follow the same path that's been followed up until now. And then the second part of the conclusion is, given the sector's mission to protect and promote health, we also have a responsibility to implement the Hippocratic Oath of first do no harm as it relates to our own climate footprint while influencing other sectors to do the same. So those are the big picture conclusions. And then there are 6 actions that we recommend to get there. The first action is, in a sense, to keep doing what we're doing, all of us who are working with global green and healthy hospitals and others who are working to address the climate footprint and to expand that across the sector. There are significant actions that we can take now to reduce healthcare's climate footprint, whether it be in Scope 1, in terms of reducing facility emissions, Scope 2, which I'll talk about in a second in terms of Action 2, but it includes investing in renewable energy that is purchased, and Scope 3, which is, again, decarbonizing the supply chain. So there's a lot to do there in Action 1. Action 2 relates to this question of the fact that most of healthcare's footprint comes from energy consumption, and most of that energy consumption is fossil fuel based. A lot of it is outside the hospital walls. A lot of it is purchased energy from the grid. A lot of it is energy that the supply chain suppliers and manufacturers consume to produce their products and transport them. And what it points to is that if we're going to actually mobilize healthcare to move towards zero emissions, we need to step outside of the hospital walls and advocate for that transition in the energy grid in our countries to clean renewable energy. This is important not only to decarbonize the healthcare sector and align it with Paris while meeting global health goals, but it is also essential to protect public health from climate change in general. It is, as we all know, the key step in addressing this problem, and healthcare needs to step up and be part of the solution. So that's what Action 2 is. Action 3 is that in addition to taking action now, we need to really create a roadmap to align with Paris and move toward zero emissions healthcare, which is really ambitious. That's a tall order, but we need to do it if the sector is going to contribute to staving off the worst impacts of climate change. So we need a global roadmap with key pathways. It needs to be based on principles of equity and justice. It needs to be based on principles of meeting universal coverage at the same time. And it needs to be based on basically the principle of those who emit the most need to take the most action. And so that means countries like my country, the United States, need to be in the lead in taking action. And based on the principle of common but differentiated responsibilities, every country needs to take action. Every country needs to move in the direction of climate smart healthcare. So really the next 2 actions are part of that. Need to help make development assistance for health climate smart. There's $37 billion a year that goes into development assistance for health. That development assistance needs to be directed toward fostering systems that are zero emissions and resilient in developing countries. Both bilateral and multilateral aid need to do that. Action 5 is to establish and implement government action plans for climate smart healthcare at the subnational and national level. These are the places where the health systems are actually controlled and managed in most countries. And so governments need to play a role in creating policy frameworks and environments for the decarbonization of the sector and for contributing to their own nationally determined contributions to the Paris Agreement. And then action 6, as I mentioned all along, is we need to better understand the problem, better understand its intricacies in order to be able to take the action to move in the direction that we're recommending. So just a quick context of what's happened with this report. So those are the findings, those are the recommendations. We released it in London in early September at the Wellcome Trust, together with the presence of UNDP, the World Health Organization, and the National Medical Director of the UK. I got the title wrong. And then we also released it at the European Healthcare Climate Summit, which was something that Healthcare Without Harm Europe organized and had healthcare leaders from across Europe attending. And so the report's being socialized and taken up by the health sector in different parts of the world. So that was the beginning in Europe. Simultaneous to that, in Medellin, Colombia, we co-organized an international forum on climate change and health, where the report was released and discussed by different healthcare leaders in the Latin American region. It's also been released at the Greening the Healthcare Sector Forum in Melbourne, Australia, at the 5th Green Hospitals Asian Conference in Singapore that had healthcare leaders from across Asia attending. And then last week at the Sustainable Healthy Hospitals Conference in Sao Paulo, Brazil, with healthcare leaders from more than 500 healthcare leaders from across Brazil attending. So the report's getting out and around, the health sector's taking it up and looking at how it can take action. We also were able to participate in a high-level event at the UN Secretary General's Climate Action Summit at the invitation of the World Health Organization, and we're able to present the findings there. And in addition to the findings, we presented a series of commitments that the sector is making to address the problem. So it's not just all problems and recommendations, but as many of you know, Healthcare Without Harm has been working with many of you and others around the world to foster action to move healthcare toward greater mitigation, resilience, and leadership on climate change. And so what we announced there in New York, and I'm pleased to share with you today, is that the Healthcare Climate Challenge has grown. We now have 200 participants representing the interests of more than 18,000 hospitals and health centers in 31 countries. These participants, those who are reporting commitments to annual reductions of CO2 equivalent of 34 million metric tons. Again, to put that in context, what does that mean? It's 9 coal-fired power plants emissions a year that commitment of reduction means. So I told you healthcare is responsible for 514. So far, we've got 9 that we're reducing. That's equivalent to 1.7% of healthcare's total climate footprint. It's not huge, but it's a start, and it's building momentum. And for those of you who work with healthcare, who are on this call, who are not part of the climate challenge, it's something to consider getting involved in, as it's a framework where there's collective global action happening to address this problem. And I just want to leave you with a couple thoughts here. One is that in addition to all of the action that healthcare needs to take to reduce its own footprint, that action two of advocating for the change that needs to happen in order to make it happen beyond the hospital walls is really, really important. And what we're seeing around the world is health professionals and health institutions starting to stand up and advocate for the kind of change that needs to happen. And so these pictures are from a very specific action that took place in September, the global climate strike. And you can see in the big picture here, this is one of the GGHH member hospitals in India, part of the Health and Environment Leadership Platform there, where you can see young people from that hospital and the hospital's leadership participating in the climate strike. The picture in the upper right is health professionals doing the same in the United States, and then in the lower right, health professionals in the Philippines. And so that kind of climate action is essential, an essential part to help move our societies away from our dependence on fossil fuels in order to both decarbonize the healthcare sector and to protect all of our health from the impacts of climate change. You all on this call are the climate messengers. it is really important to take action to address our own impact and also to be that credible, important, leading voice participating in the efforts to address the health impacts of climate change. Thank you very much.
Thanks very much, Josh, for a great presentation on a really important topic and findings for the health sector that's setting us up for some ambitious targets to work towards and I think work towards together. So it's my pleasure to jump from the global view and now learn a bit about what's happening on the ground in South Africa. So I'd like to introduce Laura Angeletti Dutoit, who again comes from the Provincial Government Health Office in the Western Cape. And Laura, pass it off to you to share what work you're doing to address climate change and work on resilience in your area.
Good afternoon, good evening, good morning. I'm going to share with you our experience on the ground, as Nick mentioned. And in the Western Cape, we have been troubled with quite a serious events in the last few years. And I will go on to share with you what we have been doing in our infrastructure buildings for the health department. The issue related to South Africa. South Africa is one of the countries that is going to be mostly affected by the climate change, and there are some projections that our temperature, most in the inland as well as around the coast, is going to increase quite dramatically. And we have signed the Paris Agreement, but we are lagging behind because, as you know, South Africa has got a lot of other issues that we have to address, and climate change is important, but we have also socio-economical issues that we are battling with. The South Africa emissions are, mostly are produced by the Eskom and Sasol. So Eskom is our producer of electricity. Unfortunately, we have only energy, except for one nuclear plant that we have here in the Western Cape. We have energy produced by coal. So as you see, Eskom, that is the producer, is producing mostly 42% of the all emission of South Africa. So whatever electricity we are using is actually coming from the coal. Sasol is a company that is producing from oil, is producing fuel and other products. This is a map of the Western Cape, and this is what we call it the heat map, with the possibility of problems and events like raising of the ocean or increasing temperature in our province. As you see, the west coast and the south coast will be more affected. And as a province, we know as a department that the effect of climate change can be quite stressful on the health system that is already quite under duress. We have most of our population. We have 7.5 million of people living in the Western Cape, and that 75.3 are actually insured population. So they are attending to public hospital, while a very small portion of our population can have access to private hospital through the medical scheme and insurance. So say that the population is also to increase. We have an average of increased population of 2%, with immigration coming from other provinces as well as from other parts of Africa. On the issue related to the service delivery, what we are aware of that the 8 waves will possibly affect the functionality of some of the medical equipment. We have an issue about to ensure the thermal comfort in some of the healthcare facilities, especially in the summer, in some area that can peak quite high temperature. And then over the past few years, we had with some extreme weather event, damages to buildings, especially due to rain and wind, but also fire, some spreading fire that actually has made quite a substantial damage to our facilities. And of course, this other effect is on our staff. We have a staff component in our departments for 32,000 staff members. And of course, the issue related to extreme event or heat waves is going to affect also absenteeism and the working condition and the staff well-being. Now, what are we doing for preventing all the above? So what we are doing, we try to become a more resilient health system. So the issue related to how do we plan in case of disaster or major event planning, how do we event in case of hospital fire, but also in the last 5-6 years, due to the increase in demand on our grid, electrical grid, energy grid, the ESCOM had to do what we call a load shedding, when they actually switch off a big component with big area of the country because there is no enough electricity for the country. And then I will share with you the water crisis, because 2 years ago Cape Town specifically was close to be the first city or major city to run out of water. Then we also focus on emergency service and center, and because we are aware that the issue related to additional patients that are coming for affected by healthy condition related to climate change, and then of course the issue about to work together with the rest of the platform, and I'm referring to local government, and I'm referring to the national government, as well as the civil society and the community per se. Now, in health, in our department, we have drafted in 2040 an infrastructure vision or a strategy, and we call it the 5L, where actually we try to design, upgrade, extend, and maintain all our buildings in accordance to these 5 Ls. And the 5L stands for sustainability, and sustainability is also has been added to the term of resilience in the built environment. Blue fit, because as you know, infrastructure in health needs to be flexible and adaptable, because the service needs change all the time. Then, of course, the reduction of carbon footprint through the low impact, and then healing environment, and above all, the issue related to lean design and construction, where we try to have an integrated approach to design from starting to the end, with the life cycle maintenance for our facilities. So what we've done in order to reduce the consumption of electricity or energy, we have of course the first thing to do is to reduce the consumption through behavior change, and then from the technology point of view, we have removed the coal burning for some of our plant or boilers, and we have only few left because we have the need to produce steam especially for the 2 major regional laundry that we have in the province. Then the usage of solar energy, we have quite a good example of 2 hospitals that we recently built, where we put the solar photovoltaic panel on the roof, and these are producing electricity during the day. Of course, we didn't put batteries because are quite at that time quite costly, but at least they are producing electricity during the day. And then, of course, moving forward the design of buildings that are possibly need less mechanical ventilation. Even if we have to comply with the legislation to provide the rates for air changes in a health facility. And then one of the major lessons that we learned was also that we need to measure what we are consuming, and we actually install a series of smart electrical meters, and we can monitor the consumption of electricity for most of our hospital and most of our medical health center. And if there is anything that is coming quite not right, we can intervene quite immediately. And of course, the issue about the tariff, that we need to work with the city and with other municipalities to find out what is the right, most effective and efficient tariff for the facilities. In relation to water has been a huge crisis over the past 3 years. It's still a crisis in South Africa. Because some of our provinces in the north are actually experiencing what we are experiencing in Cape Town 2 years ago. But what we've done, we have reduced the benchmarking. So we are also measuring the water consumption per facility or per type of the facility, and we report usually. And what we do, we also, in this case, we try to mitigate the impact of health facility, monitoring the water, and also installing a water meter, and then try to try through behavior changing and improve maintenance, especially in relation to reducing leaks, the consumption. Then what we started also was to investigate the possibility to use alternative water source and through the aquifer. We have a quite extension aquifer in the province that are located in different area. And actually, we were able to provide water, alternative water that is not coming from the municipality, and of course, water recycling and the use of grey water. But the engineering intervention, what we have also analyzed is the usage of water in our facility, and as you see, from most of the water is going through the domestic restroom. In the facility, so this is quite easy to adapt for example, grey water to be used for flushing. But then quite a lot of water is also going in the medical for the medical equipment, including autoclaves. And you will see that one of the issue is, or one of the technology used is to reuse the water from the autoclaves for cooling or for heating. Then the behavior water conversation. One issue is the fact that we, with the campaign, we had a communication campaign that allow to put all over facility, try to convince everybody to do a 90-second shower, drinking 2 liters, cooking with even a water for the pet, for the dog or for the cat. So it was quite dramatic at that time, because the city was announcing the day 0 an hospital cannot run, as you know, without water. Now, what we did so is some of the water that we found in the borehole, of course, was not water that you can send directly to the hospital. And this is why we had to work through the reverse osmosis and other technology in order to remove some of the chemicals. And as you see, we have done 21 of our hospital. In some other, we couldn't find any water, or was not required actually to have that kind of technology, because it's quite expensive. Another way that we went through was to buy quite a considerable amount of tanks. And the tanks for the water collection from the rainwater. We have rainwater. We have rain in the winter, so we can collect water during the winter that can be used for the summer, where we don't have a lot of rain. Now, the other one that we have been working on is to reduce the waste, and especially in relation to medical waste. And what we have installed is a series of equipment that are using a heat friction kind of technology that can change or can completely sterilize the medical waste, and then we can dispose what is coming out from this equipment in the normal landfill. And of course, on the laundry, also the laundry is quite a consumer of water, and we are looking at try to through more efficient technology. Now, the medical gas and sterilization is also another one that we look at. One of the protocol that we changed was actually the issue related to the use of oxygen in our facility, and not only looking at the behavior and the issue related to the leaks. Now, what we can do further, what we would like is actually to go through and create an hospital that is a net zero or an air facility. So try to improve in the design principle, in understanding better the way that we can strategize the design with the use of daylight signs, so passive solar heating, because we have quite a nice climate at least in this part of Western Cape. It's a Mediterranean climate, so it's not too. It's possible to use natural ventilation in a more systematic way. Then, of course, the issue about long life, not to use products that are toxic, and try to use recycling and have an approach that is life cycle maintenance for our facility. Then, on the issue related to the low impact, one of the issues that we are looking at is to use the natural refrigerant for our air conditioning system. And we have been in discussion with the with the Bavaria German state that actually we can look in the way that we can reduce the consumption of that harmful refrigerant and use a natural one. In relation to the loose fit, as you know, the health facilities are required flexibility, and we try to expand our facility in such a way that we can always make some changes and make them flexible. As I mentioned, we have an increasing population of 2% per annum that is second only to the Gauteng provinces where Johannesburg is. Lastly is the well-being and the environment, where of course is for staff and for patients and for visitors in our facility, and we try to apply always this principle in our facility. Now, conclusion, the South Africa government is committed to the 2015 Paris Agreement, but unfortunately there is a slow progress, mainly because we have a huge reliance on coal for generating electricity, and we are already affected by extreme weather events. And what we are doing, we are focusing in increasing our resilience in order to mitigate, adapt to climate change. Thank you very much.
Thank you, Laura. It's really interesting to hear about the work happening in the Western Cape, both for mitigating your current facilities' emissions and also working on adaptation, but also looking at targeting new facilities that would have net zero emissions and fall in line with the recommendations from the report. So congratulations for all your work there. So we're going to jump from the study to hear about work that's actually already happening, moving on this pathway to net zero emissions by a GGHH member institution, the Auckland District Health Board, which is also a participant in the Healthcare Climate Challenge. And it's my pleasure to introduce you to Manjula Sickler, who's going to talk a bit about the climate program at the Auckland District Health Board, what they've been able to achieve to date, which is really impressive, and also what they're looking towards working on in the future as well. So Manjula, I will pass it to you.
Thank you, Nick. Thank you, Josh. That was a very, very interesting presentation, and quite interesting, more interesting was the fact that New Zealand isn't featured in the climate footprint, which is interesting in itself, and the fact that we do actually have a very large footprint given the sort of size. Even though we're a small country, we're actually, a lot of our emissions come from transport, which means that we don't have a huge railway network. We're a very hilly country, and that requires us to transport goods by road. So thank you, and thank you everybody. Good morning, good afternoon, and kia ora from New Zealand. This is Manjula, the Sustainability Manager at Auckland District Health Board. What I might do is just switch to, there you go, sorry about that. Just give you a bit of a brief overview about New Zealand. I thought that this might give you a bit more about our understanding of our health sector. We've got 20 district health boards, public sector agencies delivering free health services across New Zealand. We have a population of almost 4.8 million. In Auckland, where I'm based, we have 3 district health boards, which serves a population of just over 1.5 million. But it makes up just about a third of our population, so it's a very condensed city. One district health board is located on the north of our harbour, and one district health board in South Auckland. We have a very highly diverse population, Maori, Pacific Island, and Asian community, and it's growing, and it's also an ageing population. Our central government health budget is about 20 billion, and represents about a fifth of government spending and 6% of GDP. Our funding for each DHB is population-based funding formula, which means that we get funded on our population and also the needs and demographics of our population. So higher the need. Now, New Zealand's population isn't high, but it's actually per capita basis. We have a very high carbon footprint, 18 tonnes of greenhouse gases per person every year. And this is mainly because we are a highly high agriculture country, exporting our milk and other produce that we produce from agriculture overseas. 40%, almost 47 or almost 50% of our greenhouse emissions come from agriculture, 18% from land transport, and the rest is made up from domestic and international aviation travel. A national perspective is how we govern in terms of the climate change and the impact of climate change in terms of policy and government strategy. The Zero Carbon Amendment Act will be legislated over the next few weeks or possibly in the new year. That has gone through a number of submissions, and it's really driven by we call the Generation Zero. They were very active in this space, and when the new government came in 2016, the first thing the Green Party did was take the Zero Carbon Carbon Bill into Parliament and start the submissions. And now we've got cross-party agreement to have this bill now legislated, which will mean the Zero Carbon Act will be looking at zero carbon economy by 2050. One of the things that's driving our outcomes for not only healthy people, a healthy economy, is the Treasury's wellbeing budget, which is a new approach for this government, which is placing the wellbeing of New Zealanders at the heart of government policies. This is then created the Living Standards Framework, which is largely based around the UN sustainability goals, and the framework is a measurement tool that will inform the governments on policies that affects the living standards of all New Zealanders. The other piece of work that's come out of government is the new government rules of sourcing, which basically is it's the way we will purchase, the public agency will purchase, that looks at the broader outcomes that are socially, environmentally, financially, and culturally based. So there are 4 priorities. Access for New Zealand businesses, construction skills and training. So this is to encourage the construction industry to take on apprentices and drive the construction industry. Also, health and safety standards. And 4th priority is reducing emissions and waste. So from a sustainability perspective, our vision is to meet the needs of today without adversely impacting on the needs of the future generations. What we've done in Auckland DHB is it's people-driven. We've driven our sustainability program with a mindset and culture that actually are driven by our sustainability champions, who are really very enthusiastic team of people who want to do the best and see the opportunities of actually reducing waste, improving our carbon footprint, but more importantly, being part of the step change that's needed in the years to come. So this is really inspiring others to take the lead, letting them flourish, creating some leadership models within the services that help drive change. And we, as an organisation, realise that we can't do this alone. So we do that in partnership with the Auckland City Council as part of a Healthy Auckland Together program, which looks at creating environments that provide drinking water, cycleways, footpaths, and also another part of it is living lightly, meaning how do we reduce our consumption and and create a carbon footprint that's not only less but also healthy by taking electric vehicles, bringing electric vehicles, driving electric bikes, cycling, and taking public transport, and reducing the emissions on the road, because we're a highly congested city as it is. So there's a lot of drive from our council to really encourage its population to move to different modes of transport. We also work with ECA, which is the Energy Efficient Commission. It's a government-owned agency, and we do a lot of work with them to actually create an efficient energy program, and I'll talk more about that a bit later. And we also report our emissions through to 2E2, which is it used to be called CMARS, but that's just changed its name to 2E2. It's a Maori interpretation of looking at the well-being of the planet. So who are we? We are a large employer of 11,000 people. We're also a specialist tertiary hospital. That includes neurology, cardiac, children. It's a national children's hospital. It's a national women's hospital as well. So there's 3 or 4 different major hospitals combined into one. We have a local population of 500,000, just over 500,000. We're also a teaching hospital. We have a budget of just over 2.1 billion. It's one of the fastest growing DHBs in New Zealand, and it's also one of the 10th largest hospital in the world. And we have a growing population as well, which is actually occurring now, because we are on a day-to-day level, we are experiencing just over 100% capacity each day, which is creating huge issues for us in terms of churn and how do we safely admit our patients, but also discharge them in a manner that's safe as well. So it's coming back to the notion of do no harm. We have 2 main hospital sites, one located in central Auckland in Grafton, and one located about 7 kilometres away in Green Lane, covers just over 300,000 square metres. We treat 1 million patients a day. We use about 1 million litres of water each day. And in 2018, we reduced our energy consumption from almost 89 million kilowatts to from 100 in 2 years back. And in 2018, our staff, mainly medical officers, clocked up 38 million passenger kilometres. So we have a large footprint. What does our sustainability strategy look like? This is board-led and people-driven. We are just embarking on a new program that will align our services and strategy to the UN Sustainable Development Goals. Now, this is a piece of work that will take us a number of years, but the idea being that our strategy will also align with, and the targets will also align with the SDG targets. We want to be carbon neutral by 2050, align with the national policy. We want to have 0 waste to landfill by 2040. That's introducing new technology. We also want to reduce our energy and also increase our renewable energy, and we're calling it the Energy 50/50 program by 2030. We're also driving sustainable transport and expect to transition to EVs by 2040. We've got a massive green building program underway over the next 10, first, second and first and second tranche is over 10 years, and then the long term is to replace some of the older buildings. So a lot of our buildings are more than 30 years old. Our plant building is just 50 years old, so a lot of these very old buildings are now up for replacement. We're also looking at we want to move to more sustainable procurement, and have started this piece of program which is regional to move to more transparent look at how we procure, what we procure, and putting more integrity around the criteria. This is from I think it's called it's from Europe, and it's called the wedding cake. A diagram which looks at the economic, social and biosphere and layers and the SDGs that align to it. So we've taken this as approach for our SDG program, and we see in the middle we're using the Treaty of Waitangi as a core to drive our program, because this is very much in partnership with our local Indigenous people and also working with our local iwi. So this is a centre. This is basically saying this is very important to our organisation, and our local iwi are also partners in delivering healthcare services. So we work alongside finding solutions and preparing new plans and strategies that enable our local population, our mana whenua, to actually enjoy and benefit from healthcare, which in previous year they haven't been included, and it's certainly created issues with equity, and certainly it's not good for our organisation to actually not deal and address these issues, which is a major driver for our board. So this program and that diagram is looking at a strategic view of ensuring our stakeholders and those involved in that decision making are part of the long-term plan for this city. What does that emissions trends look like? As Nick mentioned, we've had a dramatic decrease in emissions over the last 4 years, mainly driven by energy. Gas and electricity has been the main driver for this. We've reduced our energy by 36%, but overall emissions reduced by 28%. What do the scope trends look like? You can see scope 1 is showing that the energy has come down quite dramatically. We've got scope 2, we had an increase in medical gases and some waste, but we also had some decreases in air travel. Now, there's no reason why this fluctuates from year to year. We've just done the 19 cut of our emissions, and we think it's driven by cheap airfares to Europe. A lot of our medical doctors travel to Europe, long haul, for medical training, and they travel business class. So business class travel is the key driver in our emissions. Better energy 50/50, I just wanted to explain what that looks like. So we are one of the top 200 users of gas and electricity. We also believe that we needed a much more stronger policy around managing our emissions. So part of our green building design also aligns with the better energy 50/50, which requires us to look at better monitoring system, control optimization, lighting controls, better lighting, LED in car parks, and monitoring our buildings. So we've been working with the ECA, which is the Energy Efficiency Conservation Authority, and we've identified several projects that would reduce the energy consumption and develop processes like monitoring and control optimizations that actually not only reduce consumption but actually reduce cost as we become aware of them. We've also conducted some energy conservation awareness activities, signage, newsletters, and competitions and residential programs that help people bring awareness and also enable people to do the right thing. We've also, as part of our maintenance crew, we've ensured that our maintenance staff and contractors, when they're looking at repairs, they take action and rectify energy wastage as soon as it's logged, when it's logged by our users. Our lighting has been had quite a prominent place in our program. We've switched to LEDs, which is reducing our energy consumption. We've just installed 2,500 light fittings over the last year, and this is in lamps and light fittings, which has reduced our energy by about 140 kilowatt hours. We're just about to start a detailed building monitoring program, and that will in this building that I'm located in, which is the Lab Plus building. There's almost 600 people working here, and it's a 24/7 operation. It's one of the largest consumers of energy because of all of the electronic equipment that we have in the labs. So this building, we're calling it the B-Tune. So what it will do is it will constantly tune the building for efficiency over the next 18 months. We'll have about 50 elevators to be upgraded and renewed, and these will be equipped with green technology such as high energy efficient motors and regenerative braking. This is quite new to this organisation, and it's quite an exciting part of the featured way we're going to be doing things. And the contractor that installed the new elevators and technology will be monitoring them to save energy and also manage the performance. As I mentioned earlier, this is our sustainable procurement strategy that looks at, as you know, Auckland's located at the southern part of the world, so we have to transport by ship and sometimes by air, and most of our goods. This organisation spends about $7 billion on clinical supplies. It's quite a large expense for the organisation, but we also want to be sustainable. So our vision is to create a strategy that will deliver goods, not just bottom line savings, but also goods that are sustainable in the long term, that look at the social and cultural well-being of communities, and also reducing, and not only in New Zealand, but also where we source our goods from. And that means that we will look at our supply markets and look and ask them about their resource extraction, recycling and disposal options, the employee rights and conditions. We will look at unfair competition, unfair practices, ethical behaviour as well. And because we can't say on the one hand we're adopting sustainable procurement, but on the other hand we're not paring down the pathway of ignoring some of the countries that are actually engaged in unfair practices and unethical behaviour. So we have to actually align our vision and values with suppliers who've got similar values to us. That's a very important key in order to create a much more sustainable procurement. And then we can say, hand on heart, that we as an organisation are driving change, but we also want our partners to be part of that change. What's missing from our emissions reporting? And it's a very good question, because we have just started our emissions reporting journey, and there is still a lot to do. We're not reporting pharmaceuticals footprint. We're certainly not reporting procurement. And if you look at that graph beside those bullet points, you'll see from the NHS, the procurement footprint represents 61% in the NHS. Now that's quite significant, so one could say we haven't actually started looking at these areas, and this is a major piece of work that's going to have to be undertaken nationally through the agents that we work with to identify how do we report footprint from all the products that we buy and the pharmaceuticals. Transport, travel, patient, commercial deliveries, air ambulance, and ambulance. We are not recording that. We don't actually have any systems to record this. So there's quite a lot of work that needs to be done to set the systems up in order for us to capture that data and work with our stakeholders as well. And we don't capture the footprint from buildings and fittings and equipment. A lot more work to be done there. And also we don't capture footprint of services delivered in the community. This is NGOs, residential care, laboratories, pharmacy, GP practices. So you can see that we've got a long way to go. But as I said, we've just started this journey. We've got challenges, but there's also opportunities. This is we see this as a long game. This is not going to be delivered in the next couple of years. As we transition, adapt, and develop new technologies, systems, and processes, we will see step changes, not significant, huge changes, but step changes. This is an industry that moves quite slowly. We've got challenges, we've got financial constraints, and this is a major issue across all the DHBs. This is largely driven by demand and unmet need. So we are now seeing ageing population, complex patients, and not sufficient funding to address all the needs that we need to deliver. Mitigating the harmful effects of people's health. This is an area that is going to be challenging for us, so this is why we've adopted the UN SDG goals. We believe that as a healthcare provider, we have an obligation, a duty of care to deal with not only our own footprint, but also the harmful effects of climate change on our people. As I mentioned earlier, our buildings are aging, and as they age, they become more and more inefficient. Transport is a major headache for our organisation. Our site, which is located at a very busy part of Auckland, has major congestions every day, which is creating issues for patients getting on site. So this is creating another issue in terms of meeting cancelled appointments, missed appointments, emergency care, and at the moment we're working through a program that will take a lot of our staff cars away from the major car parks, and so allow our patients to get here much faster. Sustainable procurement is another challenge, but there are also opportunities, and what are they? And the thing is that we believe we have to partner. We can't work in the same way we've done before. We need to work with others and overlap some of our work so we create a bit more efficiency around that, but it's not actually adding more cost to it. So there's a lot of duplication in some of the other agencies as well, and we see our best way of delivering the best care and reducing our carbon footprint is in partnership with other sector agencies, public sector agencies, the procurement agencies, our NGOs, our suppliers, and we will work with everybody to create, basically just creating a more sustainable city. Our opportunity there is expanding the UN sustainable goals as business as usual, but we also want our stakeholders to address the climate change in context with the goals and adopting the goals themselves. Opportunities are climate change risk assessment, the Carbon Zero Carbon Act and the establishment of the Climate Change Commission will enable us to really look at what our climate change risk assessments are and looking at our current program and strategies and models of care to align those strategies with any and identify any gaps that may need to be addressed in the long term. External funding is an opportunity for to drive infrastructure projects. This is an opportunity through the Treasury as well as ECA, and hopefully the establishment of new green investment funds. I talked about technology and innovations earlier for waste. We're looking at technology to drive our waste issue, and rather than take it to landfill, could we actually process our waste on site through waste conversion or waste to energy? This has been taken seriously by our CFO, who's our major sponsor, and she wants us to look at what are the feasibilities of doing on-site waste management. Our future fit framework is to monitor and report progress against the UN goals, but as well as goal number 13, which is climate change. And we're talking with the universities, our tertiary institutes, as well as other agencies to basically discuss what a future program framework would look like for an organisation, a health organisation like ours. We think that this is more groundbreaking. This is not something any other organisation is looking at, but part of the program is to say, well, okay, how do we know how well we're doing against the goals, against our values, against our people? Are we delivering what we promised that we would deliver? So we wanted to have a framework that would allow us to monitor and report against it. And in time, I'm sure the Ministry of Health will look at this as a perfect way for all the DHBs to work towards. Product lifecycle assessments. This is another exciting place that we want to look at in terms of product and product life cycle, so we can actually capture the entirety of emissions from resource extraction to end of life. And we're working with a lot of the agencies such as Baxter Healthcare, Johnson & Johnson, BD, and Fisher & Paykel, who are the three very big suppliers in our organisation. And they are working with us as well. They want to explore what product lifecycle assessment would entail. And as I said, we've just started that with these agencies because they are connected to global parents, and they help us in terms of giving us the breakdown of products and the energy use of those products. That's an exciting part of it. But as I said, this is not short term. This is very much a long game. What are we doing? Climate excellence, and as a large organisation, yes, we were recognised, but you know, at the end of the day, it's actually constantly working towards improving our carbon footprint and bringing everybody along on our journey and providing leadership from the top and from within our own organisation and teams, encouraging people to flourish, lead, inspire others. We don't all have the answers. I'm certainly not the expert in energy. I'm not the expert in engineering. I am a good facilitator. I bring people together, and I have a financial background which helps with business cases, but also more importantly, able to bring everybody's ideas and inspirations together that help us map what's the best solution and getting the best outcome for everybody, because it's a large organisation and one service from one end of the organisation to the other is very, very different. They have different products, different services, different expertise, different instruments, different waste, and different people's concept about environment, sustainability, climate change. And so there's a lot of learning that goes on in our organisation, both from operational and through waste, through medical training, through our nurse educators. We held regular forums, events. We held one last week. We hold annual symposiums, and we get speakers in. We align with the program, the speakers program at Auckland University. And as I said, it's a very comprehensive piece of work. And I'll leave it at that. Thank you, everybody.
Excellent. Thank you so much, Mandela. It's really impressive to see the leadership that your organization has taken on these issues and the achievements that you've had so far to date. It's really, really exciting, and I think a great example for others to see how you've done it and follow in your footsteps. We have had a series of questions come in for the presenters throughout the session. And Laura, I'd like to start with you. One question was interested in how you're funding these different projects that you're doing throughout your facilities that you mentioned, whether they're retrofits and upgrades or looking at new facilities, and how you're able to provide funding for that work, and also how you've been able to get the leadership of the Provincial Department of Health really engaged on these issues and committed to working on them.
We are using the funding from the National Department for that is coming through a grant. And then in 2017, when we experienced the water crisis, we had a special funding from the central government for rescue because the region was, the province was declared a disaster region. So we had a special funding for the water project specifically. But also the private sector came up in help. For example, the water metering project was actually sponsored, quite a substantial one from Microsoft. So we had help from also international company to assist us with funding. Of course, we don't have never-ending capacity of funding, so we are trying to limit it, to do what is actually absolutely necessary. But we found that the investment on the alternative water will bring a huge return of investment because we will not use the water from the municipality, so there will be a saving. So we have been working also on the cost-benefit analysis and see what is a live return for the investment that we are doing. Regarding the second question, of course, I'm part of the top management of the department, so I'm an advocate for the green and for combating climate change. But of course, everybody in the department as a leadership, from the head of department to the minister, are actually committed to, and we actually experience on our life, with the water and energy crisis. So it's a reality, and we need to do something about it. Thank you.
Excellent. Thank you very much, Laura. And Josh, we had a similar question come up that I wanted to pass to you. Is that you mentioned the need for financing of this work to happen. And, for an individual hospital or a healthcare system that's really interested in reducing its climate footprint, but lacks the resources to do so, what are your suggestions in terms of funding opportunities to do that, or how they can begin this work without significant resources?
Thanks, Nick. I mean, it's a tough question in that every place is different and every situation is different, and so it's hard to answer generically, but I'll give it a try. One key point here, I think, is that there are a lot of actions that can be taken that actually save money. So energy efficiency, which is one of the first steps that any hospital or health system should take in addressing its footprint, can actually reduce your energy bill. And so there are a series of different actions that you can, and case studies of hospitals that are doing this on the greenhospitals.net website that you can find and draw from. So that's one. Two is that there increasingly in different countries, there are different creative financing mechanisms to help institutions, whether they're health institutions or others, invest in clean renewable energy. So that's two. Three is that, as I said, I think the whole health development assistance infrastructure all the bilateral and multilateral aid that's going out there for health needs to shift to support this. And so that's something that Healthcare Without Harm and our colleagues are committed to trying to help make happen, to actually free up the resources so that the investment that does happen in health development happens in the interest of not just meeting health goals narrowly defined, but also meeting health goals broadly defined in terms of addressing climate.
Excellent. Thanks, Josh. And then one final question for you, Josh. We had a question related to if research is going to be done or there's opportunities for it to be done on the regions that weren't included, such as Africa and the Middle East, and if there's also any further research projects related to this area that Healthcare Without Harm is looking to explore in the future.
Yeah, so our hope is to be able to develop a more robust analysis over time that includes Africa and the Middle East and other low-income countries and middle-income countries that aren't included in this initial study. And certainly, for instance, South Africa is a place that we would love to figure out how to do an analysis of the national healthcare footprint in order to support the work of Laura and others in moving their work forward. So that is our ambition, and we also, as I mentioned, want to really better understand that global supply chain because that's a key piece here. I'm seeing one other question that came up on my screen that I wanted to try to answer really quickly, if that's okay. Somebody asked if there's a plan to reduce healthcare energy and materials consumption. They said clean renewables are necessary but short-term due to limitations of continued physical extraction of raw materials in the context of our infinite growth economy. And I think this question actually gets to a really important point that first of all, an emphasis on public health and prevention is going to be really important in reducing healthcare's footprint because the less sick people there are to treat in the world, the more healthy people there are, the less there's going to be a need for big healthcare services. And of course, reducing healthcare's overall environmental footprint and reducing the waste that the sector generates means the throughput of materials can be reduced and therefore the footprint reduced. So I think it's just a really good point. We need to figure out how to redesign our health systems, decentralize them, reduce the transport that it takes to get to them, reduce the overall materials that are used to create and healthcare technologies and products, reduce the energy that they consume, and also implement renewable technologies. So, I mean, I think it's a combination, and just a super important point that I wanted to respond to.
Thanks, Josh. Yeah, definitely really important and a great view of kind of what we want the future to be for the healthcare sector around the world. So we did go a little over time, but we had some great presentations. I appreciate everybody, most of you, staying on here. We did have one question come in that I wanted to share with Josh, which is, in terms of the study that you conducted, was it able to compare emissions from prevention versus treatment within the health sector? And kind of an add-on question to that is, around prevention, what role do you see it playing in mitigating the health sector's impact in the future?
Well, that's a really good question. Good two questions. Thank you for that, Nick. So we looked at all aspects of the health sector. So public health is in there as part of it, and therefore prevention activities. We did not segregate that out and look at the difference between the two. But suffice it to say that the impact of prevention is, in terms of its own footprint, is much, much lower than a healthcare facility like the one Manjula was just describing, which is open 24/7 and consumes huge amounts of natural resources, including energy. And so I think that in terms of concern about healthcare's footprint, prevention and sort of the public health strategies are low down on the list of our concerns. That said, the converse, which is the other part of your question, is really important, which is that the only way that we're going to actually solve all the problems that we're addressing here, which is all these different health issues that the health sector is there to address, as well as climate change, the biggest health threat of the 21st century, is by moving toward a more public health and preventative-based model, and also decentralizing healthcare delivery. And so the more decentralized, on-the-ground family medicine that and telemedicine that removes the need to go to a hospital, but also, most important, disease prevention, going upstream and preventing the disease from the source. So that means both reducing emissions, but also by addressing some of the other big health problems, we're reducing the demand for healthcare in theory. And that, therefore, will reduce healthcare's footprint. So a prevention strategy is, in many ways, central to a broader approach that re-envisions health systems and health service delivery in a more climate-smart way. So that's my answer to that question.
Excellent. Thanks, Josh. And I wanted to say thank you for your presentations and motivating us to begin taking climate action and collaborating with one another and learning from members such as Manjula on how we can do that. I just wanted to close here with a few words about our Global Green and Healthy Hospitals program, which I know many of you who are on the call are already members, but it is a program and a membership network of hospitals, healthcare facilities, health systems, and health organizations that Healthcare Without Harm has been running since 2011. To date, we've grown to over 1,200 members in actually 62 countries now, constantly growing, who represent the interests of over 36,000 hospitals and health centers. And our main objective with this network is to create a place for collaboration, a place where we can learn from one another, and a place that we can work together to solve these issues. One hospital can be effective, but I think sharing our successes, sharing our challenges, and developing strategies for us to work on these issues together is where we're going to be able to see the success that we want to achieve. So in addition to creating a network that members can connect with one another, we also have a variety of different tools and resources, educational materials, such as guidance documents on different topics such as energy, water, buildings, waste in hospitals, and how to address those issues. We've been building out a data collection tool called the Hippocrates Data Center, which has a lot of different data tools for you to track what your impacts are year to year, what your energy use is, what your carbon footprint is. And we've actually been building out a lot of calculation tools to allow you to understand what your carbon footprint is, whether it's from your energy use or your use of anesthetic gases. And we'll be developing those out in other areas in the future as well. So for those of you that aren't members, we welcome you to join. It's free to join the network. And you can find out more information at our website, greenhospitals.net. And finally, just to close with something that Josh mentioned, is our Healthcare Climate Challenge, which is a special initiative that we're running through the network focused on climate change and building really a leadership cohort of hospitals and health systems and healthcare facilities who are committed to taking climate action, who are recognizing that they have an impact, that they want to mitigate it, and they really want to be a leader in this space. And so it's been a growing cohort since 2015 when we launched it. As Josh mentioned, we're over 200 participants to date, including the Auckland District Health Board, which has been a participant. And it's also a way that you can receive recognition for your work. And so, as Manjula mentioned, we have an awards program for the Climate Challenge that happens every year, where members can submit data and information, and we really appreciate the opportunity to provide recognition for the leaders from the health sector in every part of the world who are achieving success and setting an example for others to follow. So thank you again for joining us today on this important webinar on healthcare's climate footprint. The recording and the presentations from today will all be available for members of GGHH within the coming weeks. And And again, thank you to our presenters, and we hope you have a good day or evening. Take care.